Welcome, everyone. We're just going to wait a couple seconds to allow attendees to join. Okay, hello. My name is Anna, and it's my pleasure as the Assistant Director of Constituent Relations to welcome you all to this 49er Industry Chat. Before we get started, we would just like to remind you that this session is being recorded and it will be available on our website at csulb.edu/alumni. Once it's posted, please feel free to share this with a friend, fellow alumni, or someone that you know would benefit from this industry chat. We also encourage you to use the chat or the Q&A to submit any questions that you have for our guest speaker. My colleague Rosalinda will be helping moderate the chat throughout this webinar. I'm actually now going to pass it off to an exciting guest that will be helping me interview our 49er Industry Chat host, Stacy Schaefer, who is also a Cal State Long Beach alumni from the College of Business, a double alum actually. So Stacy, please take a moment to introduce yourself before we kick it off.
Thank you. Hi, everyone, and welcome. My name is Stacy Schaefer. I'm excited to be your host today. I've spent the past 15 years at PBS SoCal as the Senior Director of Marketing Operations and Business Intelligence, where I lead audience growth and marketing technology. And as Anna mentioned, I'm a proud Cal State Long Beach alumni. I have a BA in Communication Studies and an MBA. And now I'd like to introduce you to our alumni host, Rani Khetarpal. Welcome. I'll start off by reading your bio before we jump in. So with nearly 3 decades of experience across startups, Fortune 500 companies, and emerging ventures, Rani specializes in healthcare commercialization, go-to-market strategy, and digital innovation. As CEO of NavPoint Health, Rani leads a digital health company focused on transforming patient navigation and care coordination throughout scalable, tech-enabled solutions and services. In addition, Rani serves as president of AONN Plus, where they drive global conversations on navigating standards, reimbursement, and workforce advancement, while supporting a membership base of over 10,000 navigators worldwide in the Navigation Pledge. Rani is also the founder of Raviya Health Solutions, a consulting firm that advises HealthTech, Biotech, and life sciences companies on growth strategy, funding, and market execution. The firm was built on experience spanning payer and provider engagement, AI-enabled platforms, and value-based care models. A frequent speaker, advisor, and investor, Rani is passionate about advancing the future of healthcare delivery. Rani, thank you so much for being here today and welcome.
Thank you. Thanks for having me.
Wonderful. As a reminder, Rosalinda will be checking the chat for any questions attendees would like Rani to answer. But I think we can just jump in with our first question here. First, let's start off with a little background. Can you tell me about your experience and what led you to Cal State Long Beach?
Yeah, I actually transferred. I was a transferee. I did 2 years of community college in San Diego. And of course, the community college program in California is very generous in that you start there and then you transfer basically anywhere you'd like in the CSU or UC system. And Long Beach was always sort of on the radar, mostly because of the diverse programs that they offered. I wasn't quite sure back then what I wanted to be when I grew up, and I still kind of don't know what I want to be when I grow up. I think that hasn't changed. But so I when I was looking at Cal State Long Beach, it was geographically desirable, number one, and second of all, it offered, I think, in my view, just a complete diverse array of programs. So even though I went in as a business major into Cal State Long Beach, I had 2 years of sciences. It was pre-med for my 2 years in community college and realized I didn't want to be a doctor. So I didn't quite know if business was my path. It was sort of the complete opposite end of the science courses that I was taking. So, but I thought maybe if there was a different major, then I could switch and it wouldn't be where I'd have to switch universities or anything like that. So, so I think there was a couple of reasons why Long Beach was a really good fit for me. And then I actually didn't do a campus visit. I knew the area But I didn't actually do a campus visit prior to me actually committing. But I was very pleasantly surprised, obviously, when I got there. So it was great. And I believe the business building was brand new back then. And it was very not brand new, but it was newer. And so all the facilities were really nice in the business administration building and that sort of thing. And so that was also, of course, in your young mind, it's all shiny and new and pretty, and of course the pyramid and all of the things. So it was a really, really neat entry into campus for me as well.
Absolutely. And I'm sure that's a similar, experience for a lot of students joining Cal State Long Beach as well. What was your student experience like at Cal State Long Beach? Were you involved in any clubs or activities, jobs on campus?
Oh gosh, I actually did not have any jobs on campus, but I took a full load because I came in with very limited prerequisites for my major. I had sort of had to double up. So I just remember, because it was so recent ago, trying to think. I do remember taking 21 units. I had one paid job. There was a Sears back then, right by campus, and back when Sears existed, in a brick and mortar store, and I sold fine jewelry. And so I did that for money. And that was really close to campus and really close to the apartments I was living in and dorms and all that. And so I kept that job all through college because it was very lucrative for a college student. But then I had I always had at least one or two internships going at the same time. So taking a full load with the internships and, the paid job, it was quite a bit. And so a lot of my time was obviously spent in those activities and experiences and classes and so forth. But I did manage to actually get involved with Delta Sigma Pi, which was the business fraternity on campus, the co-ed business fraternity. And that was probably one of the most enriching experiences I had on campus. And I was also part of the Asian Indian student club there as well. And so led a lot of activities. I was an officer. I was also did a lot, with Delta Sig as well as the Indian Student Club. So between the two, pretty much, and then all my full load and my work and the internships and all the things, pretty much. And I was heck bent on actually, graduating in 2 years as well. So I was like, I got to get out in 2 years. So I was quite busy during my 2 years at Cal State Long Beach for sure.
Absolutely. Well, it sounds like a wonderful experience joining those programs and that you found time in your busy schedule to do that. So thank you for sharing that.
Absolutely.
And what made you want to pursue a career in the industry that you're in? Was your journey, would you say, intentional, or did you more kind of fall into it?
Um, I would say healthcare was somewhat intentional. I didn't because of my science courses, and I switched to business. I was actually one of my favorite internships in college was I worked for a firm called G2 marketing or G2 advertising. G2 advertising was a division of Gray Advertising, which back then was one of the biggest advertising agencies in New York. And they actually had G2 was created for automotive accounts that were based in Southern California. And so I remember the offices were in Huntington Beach, right off Beach Boulevard, right by the mall or the news center. I forget the name of it now, but the news center that's there. There's a big glass building, and that's where their offices were. And of course, as a 21-year-old, you're 20-year-old, and you're walking to these big glass buildings. It's very impressive, and you're dealing with New York, and it was all very sexy and exciting. And so I really was actually wanting to pursue advertising as a potential career path. And then I was talking to some folks that were older and wiser than I was. And I don't know about wiser, but certainly older at the time. And so they mentioned that, hey, you should look at pharmaceuticals because it's a good blend of your science courses and your business courses. And, it's really a really interesting career path. And so I started exploring that. And so I ended up getting some interviews, right? actually through Cal State Long Beach at the career fairs that I attended. And so I ended up really looking at that industry as the pharmaceutical industry on the business side of things as a really great fit because of the science background I had and my interest in marketing and advertising. And I didn't really understand sales at the time. I just didn't. Wasn't something, but I sold fine jewelry, so I was able to leverage that experience. And turn that into sort of that path into pharmaceuticals and healthcare. So, but I will say that it was very non-traditional. So I landed a job in pharmaceutical sales right after college. It was a territory in Palm Springs and selling a drug back then called Sporanox, which is now generic and over the counter, actually. But back then it was prescription and it was for nail fungus. And I mean, like I said, not sexy, but hey, the job was great and paid really well for a new grad and all the corporate account and credit card and the car and all that stuff, but it was in Palm Springs. And my boyfriend at the time had moved to the Bay Area for his job. And so I actually declined that job and took another job in the Bay Area that had nothing to do with healthcare. And that was probably, when I look back on it, the first, without even realizing what I was doing, really kind of set the tone for my propensity in stepping into unknown territory. And that has followed me and led me throughout my career. Because when you look at innovation in healthcare and you look at some of the things that are happening over the last 30 years in healthcare since I graduated, it didn't exist when I graduated. And some of the things that I have done is because I've taken that risk and said, yes, let's see what this is about, right? For whatever reason, whatever circumstance surrounded it. So this was really that first of like, I'm going to give up this really lucrative job and I'm going to follow my heart, right? My boyfriend was there and it turned out to be okay because we ended up getting married. But I ended up taking I call it my internship, my 6-month internship. I sold pen and paper. I sold office products, right? Literally sold office products, right? And it was a 100% commission after like 2 or 3 weeks of pay or 3 months of paid training, very minimal paid training. So you can build your accounts and then it was, and I actually did really well. I was in my recruit class, I was the top salesperson, whatnot, but I knew I wanted to get back into the pharmaceuticals industry. So I ended up interviewing while I was up in the Bay Area and 6 months later landed a pharmaceutical sales job in cardiology with Abbott. And that was my first sort of step into pharmaceutical sales.
Wow, that's quite the journey. And thank you for sharing that. I feel like a lot of us, especially in marketing, we, at least a while back, it was advertising was like the entry point of their interests. And then you kind
Yeah.
of expand and grow, and then you find your focus that you draw that passion to, and that then evolves. I agree, similar path here with myself. Was there, would you say, a pivotal moment when you realize patient navigation and care coordination would become that's central to the future of healthcare?
Yes, it in 2010. So this was about I had gone this was 12 years after I graduated. I had done an MBA at I didn't go back to Cal State Long Beach. I ended up doing it at St. Joe's University out of Philadelphia. I got a healthcare executive MBA, which focused on pharmaceutical marketing and management. And I was in a role with a company called GlaxoSmithKline, one of the big ones, and I was what we called an above brand role. So I was working with hospital and health system executives to really understand some of the problems that they were facing and how GSK can align to help them, whether it's with the disease state or something else. And we had a program called that was centered around care management, and back then care management, case management, care coordination, and was sort of the buzzwords. And this was right when the Affordable Care Act dropped under the Obama administration. And so when that dropped, the hospital and health system world were in a complete frenzy because there was a portion of that that was going to penalize hospitals for readmissions within 30 days for certain conditions. And they had outlined to start with 7 specific conditions that if they were readmitted within 30 days, that the hospitals would not get reimbursed by Medicare or Medicaid under the Affordable Care Act. And so they had about a year or so to determine, how they were going to, before these penalties kicked in. So I'm sitting at the table with these executives and so forth, and they're talking about all of this. And so as part of just to understand a little bit more, I always did a little bit extra research, to understand what's going on, but also to contribute and to take back to the company and try and develop programs and things. And so I was on a cross-country flight and I picked up a magazine called, it was the US News World Report, but it was the state of healthcare. And it was all about the ACA, the entire issue. So there was a small kind of 1.5-page article on a program called Clinical Transitional Care. And by the end of the flight, I had all of these notes in the margin. I still have the magazine to this day of like, this is it. This is the answer. And I was going to a sales meeting, an internal sales meeting, and I didn't pay attention at all to the sales meeting. I was actually just writing notes on a business. I was writing a business plan essentially of how this would actually help, right? And how this needs to be the thing. This is the answer, right? And at that time, this model was only sitting at the University of Pennsylvania School of Nursing. And the gal, Mary Naylor, is a nurse there who developed this program and was testing it out in the academic setting. And that's where it stood. And I thought, there's got to be, this is it. So, I come back home, I kind of put it away, meaning, life gets going. And about 6 months later, I'm in a conference room at a hospital and same thing, it comes back up and I'm like, you know what? This is the answer. I got to figure something out. So I cold called the University of Pennsylvania and I asked for Mary Naylor and she actually picked up the phone and I was like, oh, okay, we're going to have a conversation. So long story short, she was more than gracious, very excited that someone was interested in her research and her program and invited me out to go spend the week with her and her program and her nurses and shadow and all of these things to really immerse myself in it. And that's where my first company, Global Transitional Care, was born out of, was really developing the commercial model for clinical transitional care that was developed at the University of Pennsylvania. So in 2014, we officially launched Global Transitional Care, actually here in Southern California. And we were a medical group. So we were the first transitional medicine practice in the country. Now there's a ton of them, and there's a lot of folks that do transitional medicine and that sort of thing, but we were the first, which was very exciting. And then in 2017, we got acquired. And so that was sort of my first stint into entrepreneurship. And really, to answer your question, that was transitional medicine. It's a very long-winded story to tell you that that was really the first sort of foray into really understanding the impact of what we call care navigation, care coordination, health advocacy, all the different words that we use to basically describe guiding patients through their healthcare journey.
Wow, that's fascinating. I was not aware of kind of that experience that had been happening in the healthcare system, and great that you were able to help find solutions during that period. We did get a question in the chat. Having started in pharmaceutical sales, what lessons about customer engagement and value communication have stayed with you and continue to shape your marketing and commercialization strategies?
Oh, that's a really good question. I think the biggest one is relatability and just really understanding your customer. And it's not just the person that is like for us in pharmaceutical sales, you think that our customer is the physician, which they are. A physician is certainly our end goal, but it's not our only customer. In order to get to the physician, we have to go through a lot of different people. And so every single one of those is really the customer. And if you can relate to, I always say that it doesn't matter if you're talking to the janitor or the CEO of the company. If you can relate to every single person you're talking to, you're gonna do well. And because people want to connect with other people. And if you think about that connection, it's human, it's machine focused. That's what AI is, right? AI is really, especially agentic AI, is actually taking all of those human interactions and digitizing them to build efficiencies in whatever it is that you're working on or workflows. But you want that human connection. And the moment that that human connection is lost, then the journey becomes really tough, right? Whether you're selling, whether you're trying to reach somebody. I think that to me is the biggest piece. And that's what pharmaceuticals and sales actually really taught me. And I think, as much as I sometimes think about, well, I should have taken that job in Palm Springs, I'm really glad I took the job that was harder and took the harder route and sold pen and paper for a while because I'm telling it's a commodity, right? You can buy a pen from anywhere. Why would someone buy a pen from you? And taking that lesson and understanding just that fundamental basic learning of why someone would buy that sort of, commodity from you versus somebody else has really followed me throughout my entire career. And as I, continue to mentor people and lead teams and lead companies and all of these things. And for me now, I'm still selling. I've never stopped selling as a CEO of a startup, as the vice president of a major pharmaceutical company. Right. I mean, I've, as the head of value-based care for with top 3 organizations, Fortune 3 company, I've never stopped selling. You're always needing to relate to somebody. You're always trying to manage that connection, gain that connection so that you can, be successful in what you need to be successful in. And the relationship part is really, really important.
Absolutely. I agree. And I think, understanding your customers and their customer needs are just key. Thank you for sharing that. And I know you touched on AI, and we know AI is becoming increasingly popular and it is increasingly integrated into healthcare delivery. Where do you think AI creates the most value, and where do you think people are overestimating its impact?
Gosh, I could have $1 for every time I have this conversation. It's so funny. I think that AI is here to stay. I think that the level of AI, to kind of go towards answering your question, is going to look different for different tasks and different things. There is a area of AI that focuses on automation, which is already happening, which is already in play. It's with our company too, right? Just automating processes and data feeds and things like that. That part, and people sometimes mistake automation for true AI. It's a part of AI, but really when you're looking at artificial intelligence at its true functionality, you're looking at, that agentic piece, right? That agent that will act as a human or replace the human in a task, not all across the board, but in a task, to be able to do certain things, to think, right? And to process. And so as we get more involved in that, I think that there is going to be always a place for it. And especially in healthcare, there's always going to be a place for it. In navigation, in my field, what I'm focusing on, I just having this conversation with my head of strategy about, he's like, oh, well, there's an agentic AI navigation company. I said, but in healthcare, there are certain things that an agent can do, an agentic agent, an agentic AI entity can take care of. But what you cannot replace is me looking at you and hearing you and you looking in my eyes and through my facial expression, through my eyes, through my tone of voice, that changes, right? That understands, that nods, that is acknowledging you with my physical presence. That as a patient, as a human to interaction is extremely human focused. And I think there's certain industries, not just healthcare, but other areas where that will continue to lead and AI will support, right? And whereas in some industries, AI will lead and humans will support. And I think that if, I think that's okay. It's really okay. It's not going to be a one size fits all. It's kind of, in my opinion, very exciting, also very scary to think about capabilities that are being built around AI. But I also think that it's an extremely powerful tool for just the average person now to have access to information and answers and queries and things of that we've never been able to have, even with Google, have not been able to have before, right? I use it every day, right? But I think also the true essence of AI, is going to be defined by the industry that we're in and the objective of what we're trying to do.
Absolutely. I agree. Um, what would you say are common mistakes early stage healthcare companies make when developing their go-to-market strategy?
Oh, that's a good question too. I think it's really understanding product market fit. You have a product, you want to sell it, and you, as a early stage company, as a founder, or you know that this is the right thing, this is the best thing that's ever been invented since sliced bread, and by golly, everyone's going to want it. And I think that enthusiasm is fantastic, right? Like you need that, but you also need to understand who's going to buy your product. And is the market ready for your product? Is it and where does your product fit in currently? And I also think that early stage healthcare companies need to understand what the problem is. And is your product the actual solution? And really defining that out and understanding that. I mean, with NavPoint, we've been pivoting. Like we launched in 24, in early 24. 24, interestingly enough, navigation became reimbursable. We didn't know that when we were developing the company in 23. And in 24, we launched in March. The codes came out that year, and we didn't understand the impact of the codes on our company and on the platform that we had. But then we realized very, very quickly that we needed to build in the capability of capturing that revenue in our platform. And so we took a step back and we built that capability. And we delayed our launch for almost a year because if we had launched and then they asked that and we said no, then that's an opportunity missed. And so we had to react to the market. And sometimes we do have to take a step back. Organizations do have to take a step back and truly understand that product market fit and understand the problem and ensure that your product is actually going to be solving for that problem.
Absolutely. For students interested in healthcare strategy or commercialization, what foundational business or technical skills do you feel they should prioritize developing?
I do think they really need to understand just foundational, like how healthcare works. It's not just, there's at its core level, patient goes and sees physician, patient goes and treats at hospital. That's the core, but our healthcare ecosystem is in the US and really anywhere in the global environment too, is extremely complex. But if let's just focus on the US, it is one of the most complex healthcare systems in the world. It is the most complex healthcare system in the world. And there's so many facets to it. So really understanding the healthcare ecosystem is really, really important. Understanding how all the cogs in the wheel fit together. And how does that work? And it's okay to say, I'm just going to focus on one element of healthcare because sometimes you have to do that. I focused on pharmaceuticals for the first, 15 years of my career. And that was great because within pharmaceuticals, there's different channels that you can get into. And I got into a lot of those channels. So when I left and did this thing called entrepreneurship, which I knew nothing about, was way in over my head, I learned a lot about the other side of the services part of becoming a provider and actually taking care of patients, which is a whole different ballgame. And that's that kind of healthcare administration piece, right? The business of healthcare. And so the business of healthcare is really sort of its whole ecosystem. So I think really understanding the ecosystem is really important. And then finding that niche that's really interesting to you at the beginning, not to say that that's where you're going to stay, but really kind of diving into that piece of it that's like, hey, this is like administration. That's super interesting. Like, I want to understand how hospitals run, right? That's super interesting. Or what is this thing called value-based care? Like, that's interesting, right? Or insurance companies. Like, I know they're always sort of this, dark spot in our media, but they do serve a purpose. in our healthcare system. So what is that purpose and how do they operate, right? And there's all these different entities that are big, big players. People probably in university currently, undergrad, probably don't know what a GPO is, right? It's one of the most powerful entities in our healthcare ecosystem, more than drug companies. GPOs are huge, right? PBMs, pharmacy benefit managers, again, another huge, big, powerful player in the ecosystem. So I think it's really just understanding that and really understanding what is it that's interesting to you and really moving into that space and becoming sort of your own self-professed expert. And through that, you're going to learn how to use AI. You're going to learn how to do research. You're going to learn, how to market yourself in that because you're going to be doing that research and understanding what type of jobs are available and skills are needed to be able to be successful in that part of the ecosystem. So just by identifying and learning, you're going to be able to pull all of those skills in.
Absolutely. Not, I think advice can be applied to any industry, really understanding the full ecosystem, finding that niche, focus area that you want to really lean in on is definitely a great advice. We do have another question in the chat. As healthcare becomes more patient-centered, how do you see marketing evolving to better engage patients as active participants in their care?
Oh, hugely. So I was just at a summit a year ago or so, and this was actually almost the entire focus of the summit was um, patients as consumers and their role that is currently evolving and the choices that they're making. And a lot of it is because of social media and because of excuse me, because of AI, ChatGPT, Claude, et cetera, that where information is literally at your fingertips, right? Now, whether the information that comes through, there's always this, caveat of make sure that you're checking the information that's coming in through AI. But that power that is now in the hands of the patient never existed before. If you had a question 20 years ago, you weren't popping it into Google. You were trying to track down your physician and you are trusting your physician to their core, right, to give you the right information. And you had no backup. You had no ability to go online and look at forums and go to Reddit and see, oh, is this what you're doing? My doctor said this, but my doctor said that. So there's a blessing and a curse in all of that, right? I think the blessing is that you have the power now to get information. The curse is now you have all of this information that you have no idea what to do with, right? So we always have a very, interesting, well, we say that, you get diagnosed with, something and doctor prescribes aspirin. And so you go on to, a forum and you type in aspirin or whatever. And like 5 minutes later, you're going to die because that's just, like, oh, you can't take aspirin because you're going to die, eventually like it's going to all end funnel into you're going to die. And that's not true by any means. Right. So we always have to be careful with that. But I do think that just really that the information that's available has become really powerful. And so when you're looking at advertising to patients and consumers and going to what we call direct to consumer with services and things like that, especially in the pharmaceutical industry, we've done that for years, right? Advertising to patients on TV, radio ads, et cetera, magazines, all that. I do think that there's a responsibility we have to ensure that we're being truthful and that we're being accurate in our advertising. And I'm just talking about everything, right? We at NavPoint also have a direct to consumer product. We just launched it actually a couple of weeks ago. And it's a very soft launch, but it's the same thing of being very careful. I had to go to my marketing folks and as I was reviewing our social media ads, just making sure that we're being very uberly accurate in our messaging because we don't want the inference to be something different than what we can actually provide. And so I think there is definitely a moral obligation to ensure that you're being accurate in your advertising. But I do think that it is necessary. And I think if we don't do that, then we're minimizing the intelligence of the consumer nowadays.
Yeah,
Thank you. We give them credit for.
Yeah, definitely living in a different time today with access to all these tools and technology at our fingertips. It's wild. And then how important is mentorship in this industry? Who are your mentors? Do you have any mentees? Can you talk a little bit about mentorship?
Oh, absolutely. Hugely, hugely important. I am the biggest proponent of mentorship. I am a mentor. I have been mentored. I continue to be mentored. Now it's a lot of, I used to have a lot of mentors that, helped guide me through my career. And now I have like very, very few, and most of my mentors are now retired. One of my co-founders is actually one of my mentors. So for NavPoint, so it's such a treasure to be able to work with your mentor side by side and have her trust in me to run the company. She's part-time with the company, but it's very it is extremely important to be able to have that support in your life, and as in your career. And not to say that that males aren't important, but as a female and as the things that we face in our life in terms of how we're wired around motherhood, and if a family is something that you're desiring, but you also want a career, you can have it. You can have those things. And you can have them both at the same time. I mean, I have 4 kids. They're all older now, and grown. My last one is graduating NYU. She's going into her senior year, but all 3 of them rest of them are up and gone from college and working. And I did it. So I did everything in my career alongside motherhood. And so how do you do that? And it's a very scary thing to think about, especially nowadays, right? Of like, I've got to have kids, and I want to have kids, but I want to have a career, and I want to have a successful career, and I want really great kids, and I wanted to be a devoted mom and wife and all of these things. And that's where I think my mentors and my tribe, as I like to call it, were really, really important to ensure that the decisions you're making, the sounding boards, are there so that you have the ability to talk it out and to get that guidance. And I also think it's equally, now that I'm in a position to give back, that I do give back. And so I do actually have several mentors, and NavPoint is actually kicking off a new grad program. I have about 5 new grads on my team. We're a very small company because we're, a startup, but half of my team are all new grads, have been graduated for a year or less. And I absolutely think that it is the most important thing you can do is to provide opportunity. And I was provided opportunities, and so giving back and just understanding how important those are. And it's not just giving them the job, it's also guiding them through that process and through that journey. So I always tell my folks that, you're not just with me for the 6 months, 12 months, 2 years, 3 years that you might stay with this company, but my job and my leadership team that has been in the workforce for, the same amount of time I have, or close to it, is their responsibility is to continue to guide you through that. And if you can find that in your early stage career, or even while you're still in school, then you're very, very blessed. And you're going to be able, and I tell that to my own children, that find those mentors, get those mentors, make those connections. And it's not that you need anything from them, but when you do need that advice, when you do need that guidance, when you do need that connection to somebody or something, that they're there for you. So, and they become not just your mentor, but your champion. And the difference between a mentor and a champion is a mentor will talk to you face to face and guide you through that, but a champion will be your voice when you're not in the room. And if you can turn that mentorship into a champion, then that is your holy grail. And that takes time. That doesn't happen overnight. So you've got to start nurturing those relationships very, very early on.
I definitely agree. I'm also a mother, so I
Yeah.
it's doable. It's tough, but thankful for kind of
Yeah.
the group that's around you to help get there. And then just a last question here is, what advice do you have for 49ers interested in making a career in your industry?
I would say if you can find, while you're in university still, in school, is find a role, even if it's unpaid, and just say, hey, I want to volunteer at your company just to get the experience. I think we so often focus on this word internship, and an internship is like, oh well, I gotta pay a salary because you're an intern in California, especially. They're very strict about that, either course credit or salary. But sometimes if someone comes to me and just like, hey, I just want to volunteer for like a month, and just tell me what to do. I'm just going to show up. I want to learn. even if it's just sitting there and being a fly on the wall and learning, how it works. Like I would never say no to free labor, even if it's just, formatting a spreadsheet, right? Like that's even experience because you're going to be able to see data. You're going to be able to see how the mind works and how things are put together. I had a gal that is now one of my paid staff members. She just graduated from BU. She was a volunteer with me for 2 months. She just volunteered, and said, can I just volunteer with you? And she was remote and she's in Boston finishing up her degree. She graduated earlier this month, and she started with me 2 weeks ago, so you just never know, like, don't be afraid to ask, because if you don't ask, it's always a no. So if you see something or you're researching it, it's local company, even if it's just say, hey, I love what you're doing. This is super interesting to me. I'm a junior, I'm a senior at Cal State Long Beach, or even a sophomore. I think sophomores are okay, but I just want to spend some time learning. And I mean, I'd love to do an internship, but I'm also open to a volunteership, like whatever it works, just find and get the experience. So you know what you can actually talk the talk, talk the lingo, know what you're getting into. So when you are actually going to interview for those jobs, you have the experience because your healthcare is very, it's very hot and cold in sense of roles because you'll go through this really hot period and everybody has jobs and everybody's hiring and there's not enough people to go around, and then the government will decide something and then there'll be a oh crap moment and then there's layoffs, and so now all of a sudden as a new grad you're competing with people with a ton of experience. And that's where I find that new grads have a lot of issues with landing roles. But if what I find too is that those that have done the work and put in the sweat equity, really early on are the ones that will typically get those roles right out of university and do that. And so this woman, this new grad that ended up working for me, just as a quick story, she I met her in person. I was at a venture summit in Boston. And she somehow snuck into this event. I don't even know how she snuck into this venture summit. She has a story. She told me about it. She said somebody invited her, or she couldn't go and gave her the pass or something like that. And so she just went. She goes, I just went to meet people. That's all, the whole reason I went. I don't know anything about that. I'm not raising money. I don't need to be at a venture summit. But and that's where I met her. And I was so impressed with her. I said, why? She goes, can I call you? I said, absolutely. I gave her my card. She actually followed up with me. I had an hour conversation with her on Zoom. And then next thing I know, she's working for me, right? For a month and a half, almost 2 months. And then next thing I know, now she's part of my staff. So and that just happened. Literally, that's a real story that just happened. So it is possible. It's just, you've got to put in the effort. You've got to put in that sweat equity. You've got to take the risk and don't be afraid. I think so many times we're shy. We don't want to be embarrassed. We don't want to be like, we don't want to bother people. No, trust me, bother, right? It's okay. People love to talk to you. And so attend those venture summits, go to those dinners, right? Build your network, because networking, I probably the key to everyone's success is your network. Build that network and continue to build it. People that I've known since college, I continue to are continuously in my network, right? And it comes in very much handy throughout your career.
Yeah, I agree. And you don't get what you don't ask for. So absolutely.
It's always a no. If you don't ask it, it's always a no.
Yes. Well, that is our time for today. Thank you, Rani, for joining us. Once again, visit the alumni website in the weeks ahead to see this and other recordings, as well as a schedule for upcoming virtual events. And lastly, make sure to follow us on LinkedIn. Thank you and go Beach.